an intriguing paper that looks at something as simple as chewing gum and its effect on postoperative ileus. We know for a long time that postoperative ileus has a significant impact on recovery and morbidity from major surgery, and it has been postulated that it's a response to intestinal handling, possibly mediated through some inflammatory agents. We have also known that activation of the autonomic nervous system could be a means of reducing ileus. Gum chewing, it has been suggested, might mitigate ileus through an effect on the vagus. Now, is this a clinically usable tool? In this study, a randomized controlled trial, the authors looked at adult patients undergoing elective open colorectal surgery, and the group which was given the intervention was asked to chew gum starting 3 hours before surgery and asked to resume it 3 hours after they recovered and were allowed to take it ad lib. As a control, the authors also used a dermal patch containing a placebo. The study was able to enroll 60 patients in each arm, of which 52 in the chewing gum arm completed the protocols and 60 in the placebo arm. The study looked at a wide variety of outcomes, comparing chewing gum as the indicator against placebo. Postoperative ileus was significantly lower in the chewing gum group. The chewing gum group passed flatus earlier, passed stools earlier, and they had fewer grade 3B complications, a grade 3B complication being defined as something that requires anesthesia for an intervention. All of these were statistically significant. They looked at some more parameters. The length of stay, although it was less in the chewing gum group, did not reach statistical significance. They measured antral size in a very objective fashion using ultrasound, and they showed that chewing gum produced a significant reduction in antral size, which was used as an index of recovery of ileus. They looked at two inflammatory markers, IL-8 and TNF-A, and both of these were statistically lower in the chewing gum group, thereby signifying that chewing gum did have an effect on inflammation. The authors therefore conclude that gum chewing is a safe and simple treatment for reducing postoperative ileus. The study is a good one. It came out of a teaching hospital in the Netherlands. It was a prospective randomized controlled trial that included 120 patients, which was the indicated a priori sample size. All patients who dropped out were treated on an intention to treat analysis, and these are two very strong aspects of the study. Being a randomized controlled trial, comparisons were all very well matched. They used a placebo control, randomization was done, protocols and trainings were used, and they found that both groups were comparable over a wide range of important parameters. All measurements were done again in a systematic fashion, and therefore putting it all together, this small but very elegant study is something that we should probably take note of and incorporate in our practices.